Good evening and welcome to Creating a Culture of Impact, Stories of Community Quality Improvement. Tonight's program is part of Empower 2021, FNU's virtual event in celebration of Nurse Practitioner Week, and sponsored by the FNU Institute for Healthcare Improvement Open School Chapter. My name is Dr. Kristen Gianellis. I am a dual certified adult and women's health nurse practitioner with over 16 years of experience in various clinical settings. I received my DNP from Frontier in 2020 and joined the DNP clinical faculty shortly thereafter. I have been involved in many quality initiatives at previous institutions, but really found a true QI home with the IHI model for improvement during my DNP journey at Frontier. I now love teaching and mentoring advanced practice nurses to make healthcare change in their communities. And I currently practice part-time at an urban FQHC in Providence, Rhode Island, providing GYN care for a gender diverse population, where I also participate in health equity QI initiatives there. So in celebration of Nurse Practitioner Week, we recognize that nurse practitioners are uniquely positioned to see gaps in care and implement evidence-based quality improvement programs to close those gaps. The format for tonight's program is Pechakucha style, which is translated loosely chit-chat in Japanese. Our NP faculty and alumni panelists will connect with us through visual storytelling of nursing quality improvement in their own communities. Each presentation will last about 5 minutes as presenters share their stories through a series of images. While telling their story, please be sure to keep your cameras off and your microphones muted during the presentations. We will certainly open the floor up for a brief time of discussion and questions at the end. But for now, I would like to introduce our first presenter. All right, so we're going to start out with Dr. Rachel Sherman. Dr. Sherman is an activist, educator, entrepreneur, and local nurse practitioner with a passion for addressing issues of discrimination, equity, and social justice. She is the co-founder of We the People of Prince George's County and is a member of the National Association Against Police Brutality, the NAACP Prince George County Branch, Black Nurses Rock Incorporated, and the Hospice and Palliative Care Nurses Association. In 2014, Dr. Sherman graduated cum laude from Trinity Washington University with her Bachelor's of Science in Nursing. She began pursuing her nursing career at MedStar Georgetown University Hospital, where she developed a passion for hospice and palliative care. In 2018, Dr. Sherman graduated summa cum laude with her Master's of Science in Nursing from Chamberlain University and is now practicing as a family nurse practitioner in Maryland, Washington, D.C., and Northern Virginia. She is certified by the American Association of Nurse Practitioners. In late 2018, she opened her own practice with a mission to provide community-based primary care in underserved areas. In addition to activism and grassroots organization, Dr. Sherman has used her voice and platform to identify and stand up against oppressive, discriminative, and substandard businesses in Prince George's County. She recently attained her Doctor of Nursing practice from Frontier Nursing University with a focus on addressing health disparities and access to quality health care among minorities in Prince George's County and Charles County. And I believe Dr. Sherman has also been just this week named Maryland Nurse Practitioner of the Year. So congratulations, Dr. Sherman.
Thank you.
All right, I'm going to turn it over to you now.
Thank you. Good evening, everyone, and thank you all for joining us tonight. And thank you, Kristen, for introducing me. So as Kristen said, I'm Dr. Rachel Sherman. I'm one of the DNP clinical faculty members at Frontier, as well as a primary, palliative, and hospice nurse practitioner currently practicing in Maryland, Washington, D.C., and Northern Virginia. Next slide. I don't think I have control of the slides. There we go. So I'm honored to have the opportunity to present the details about my DNP Quality Improvement Project titled Community-Based Patient-Centered Telehealth Interventions for Advanced Care Planning in Suburban Maryland. This wasn't my initial track. I initially had a clinical site and then COVID showed up and I lost my clinical site, but I also thought that it wouldn't be fair to the site if my sole focus was on a DNP project while we were seeing the highest rates of COVID infections and deaths in the state of Maryland. I worked at Prince George's Hospital Center, and we were tremendously impacted by COVID in the state of Maryland. Next slide. So this virtual community-based project was implemented in Prince George's and Charles counties, Maryland, and combined they have a population of approximately 1.3 million residents. To further inform my project, I conducted surveys of residents in Prince George's and Charles counties, and I found some similarities. So when we looked at the national statistics, we found that less than 33% of Americans, so approximately 67% of Americans, did not have an advance directive. And $187.6 billion of the annual Medicare spending was used on care in the last year of life. And a lot of times what we find is there is significant complexity to care at the end of life and poor satisfaction, especially when patients don't have an advance directive. So I found this to be very important. In Maryland, when I did my community-based survey, 70% of the respondents did not have an advance directive. And 94% said they had never received an explanation of what advanced care planning was. 20% of the respondents had no knowledge about any of the community resources that were available to them to assist with advanced care planning. Next slide. So to inform my project, I went to the national leaders. So anybody who doesn't understand or know what advanced care planning is, it involves learning and talking about the medical decisions that someone made that they would be faced with making, but they make them in advance if they're ever in a situation where they can't speak for themselves, or they designate a person that they trust to make those decisions for them. But the most important thing is that they have to have that conversation with that person. So we often encourage them to put their preferences into an advance directive, which is a legal document, and typically only goes into effect once a person has been determined not capable of making their own medical decisions. So I consulted with the National Hospice and Palliative Care Organization, the Conversation Project, Aging with Dignity, also known as 5 Wishes, Speak Up Canada, as well as the American Bar Association's Toolkit for Healthcare Advanced Care Planning. Next slide. My goal for my quality improvement project was to increase the engagement in advanced care planning discussions, as well as the completion of advanced directives by 50% in 8 weeks. And of the respondents that I surveyed, 0% had an advanced directive. And that was truly scary to me because we were seeing some of the worst impact of COVID-19 right in my community. We were facing a time where loved ones could not come into the hospital. Their loved ones were on ventilators and sedated and couldn't speak for themselves. So we're trying to have very difficult conversations over the phone. So this was a very scary time, both for myself as a clinician, but also for my community. Next slide. So I developed 3 tools using evidence. The first was a community-based survey and pre-visit questionnaire. So if someone agreed to engage with me in advanced care planning, I would send them via email a link to a pre-visit survey. And in this survey, there was a link to a very brief video that talked about advanced care planning and why it was important. And then there were some questions in there that inquired, how do you like to learn? Do you like to know more about information before you make a decision? How important is your spiritual wellness? So that I could get to know what was most important to my patient or my client before I actually engage them in their telehealth intervention. At the end of this survey, participants could agree to proceed into a telehealth visit. And then you see my second tool in the middle of the screen here, which was a conversation guide. And this was really important because my other team members, none of them were familiar with conducting advanced care planning discussions. I was the only person, a part of my team, that had experience with hosting these conversations and actually being somewhat effective at them. So I developed this guide to guide not only the client, but also my team members in probing questions or really exploring their experiences. What was most important to them? What were they afraid of? A lot of the stuff that we heard back was surrounding COVID, but we tried to get back to the bigger picture. When COVID is gone, because we know it will leave eventually, what's most important to you? What do you want your family to know? What decisions do you want made for you? So this checklist was really, really important with guiding patient-centered conversations. It was also really important because it helped us to establish trust. I wasn't a white coat walking into a room. I wasn't someone that had 15 minutes to spend with you to talk about life or death situations. I was your equal, and I was really interested in hearing what was important to you, but I was also able to answer some questions. So at the end of our advanced care planning discussion, participants were sent a link, a follow-up packet that contained the 5 wishes. It also contained information about medical decision-making. So if someone said to me, I have diabetes, I have heart failure, I would send them a link so they could specifically read about their condition so they were stronger to make these medical decisions. And then for patients or clients who said spiritual wellness was important, I also sent them a spiritual wellness assessment. Going through COVID was not only impactful medically, but there were a lot of people who were challenged spiritually. We were separated from our spiritual communities. We were separated from our friends and our family. So it was really good for them to take an inventory about things that they could do outside of coming together, like meditating and praying, that could boost their spiritual wellness. And I found this to be really impactful. So my third tool was a case management log, because I had the opportunity to follow my clients over time. I would check in every 2 weeks. How did the conversation go? I had participants who were afraid to talk with their families about this because we're already hearing about so many people dying because of COVID, but it was much easier for them to have the conversation because they knew more about advanced care planning. I had the opportunity to check in. Did you look at the medical decision-making aids that I sent you? How was your spiritual wellness, and what activities have you done to boost yourself spiritually now that you're separated from your church or your congregation? And then my fourth tool was a collaborative or team engagement plan. And if we go to the next slide, I'll show you my team and talk a little bit about those activities. So you have myself, I'm a family nurse practitioner, another colleague who's also a family nurse practitioner, a social worker, and a community liaison. And Demetria, Kimberly, and Cynthia, neither of them had experience with hosting advanced care planning discussions. This was all new. And it was so impactful because they were able to use this guide, and over time they got more and more and more confident. And now they're just out in the community spreading the good word about why advanced care planning is so important. Next slide. There we go. So final results, I'm really excited because of this. We had a total of 95 participants who came through my quality improvement project. And because this was virtual, I had to have participants volunteer to participate. I wasn't in a clinical site. They didn't just show up in my clinic. I had to kind of find them. And the project was successful. 85% of my participants completed their advanced directive at the end of my implementation period. And I was super proud of this because there was so much going on and so much apprehension, but we were able to break that barrier. 93% of the participants said they felt heard. They felt valued during this conversation. And it is a difficult conversation to have when you're talking about death and dying and preparing, especially when all you're hearing about is death and dying around you from this invisible monster in the room, which is COVID. But we were able to break that barrier and establish some trust from a community standpoint. And one of the things I'm most proud of is the team members who had no experience with advanced care planning, we saw a 205% increase in their confidence. From where they started to where they ended, the team was amazing, and they're still going forward. So it also solidifies the fact that medical providers are not the only ones who can have advanced care planning discussions. And when we're looking at this disparity, we really should turn to our community to have these conversations. And you don't have to be a medical provider to effectively have these conversations. And I love that. But getting back to this trust piece, like I said, I wasn't a white coat, but we also discovered some things that were happening in my community that I've moved on to a larger platform. A good percentage of my patient population or participants expressed lack in trust in my local healthcare system. And that was across the board. This was predominantly evident amongst persons of color who participated, but even persons who were not of color, my white participants. They even experienced, witnessed the devaluing of persons of color when coming through our local healthcare system. And this is a problem. So I took this to local and national and state leaders and said, what can we do about it? You know, if you ever needed to see health disparity live and in person, look at what's happening in Prince George's County, which is about 60% African American. But we have a decent median income. So why do we not have the healthcare resources that we need? Why are we dying at disproportionate numbers when you compare us to other counties? This is a problem, and this is why we have lack of trust. So if you move on to the next slide, number one, I received a couple of awards as a result of this project, and I'm so honored and I'm so happy about it. But even more important than that, this project opened the door for me to sit at tables with local and state leaders to start talking about what we need to do to address these barriers and these disparities. So I was awarded the Rosa Parks Award for Excellence in Community Activism while I was doing this QI project and working in the hospital amongst my amazing colleagues. I was also leading a daily social justice protest within my community. And immediately upon graduation, I got so many invitations to come and speak, not only about COVID, but about advanced care planning and how you can identify your lack of trust and how that can be a barrier to your healthcare, and what you can do about it. So I continue to talk about these things in my community. I continue to encourage people to talk about them. And I encourage all of you, especially students, as you move forward in your project, really take a look at equity and how the results of your project can be applied to the bigger picture so that we can really achieve social justice and trust and value in our healthcare systems. And that's my presentation. My next slide are my references. But yeah, thank you all, and thanks for inviting me to share my project.
Thank you, Rachel. What a fantastic project, and what a way to start us out here tonight. And I know that there will be people who look forward to asking you questions when we get to that section. So we're going to move on to our next presenter. Dr. Katia Hall began her journey at Virginia Wesleyan University, where she graduated with her Bachelor of Arts degree in biology in 2008. From there, she attended Centara College of Health Sciences located in Chesapeake, Virginia, and earned a diploma in nursing in 2010. She worked as a registered nurse for 3 years in mother-baby nursery services before going back to school to become a nurse practitioner. She attended Old Dominion University located in Norfolk, Virginia, and earned her Master's of Science in Nursing in 2013. She's board certified as a family nurse practitioner by the American Nurses Credentialing Center and the Virginia Board of Nursing. She worked for 5 years as a family nurse practitioner in various specialties, including pain management, pediatrics, family practice, and psychiatry. The latter prompted her to return to school for a postmaster's certificate, where she came to Frontier, or no, I'm sorry, she graduated in 2018 from George Washington University in DC, and then became a board certified psychiatric mental health nurse practitioner. She currently owns and practices at Alpha Psychiatric Services in Chesapeake, Virginia. She completed her DNP at Frontier Nursing University in 2019 and has been teaching in the postmaster's health, the psychiatric mental health nurse practitioner program since September of 2020. Dr. Hall is married with 2 boys. She enjoys spending time with her family, watching sports and exercising. So, Dr. Hall, I will turn it over to you next.
Yes, thank you guys for having me. I'm with Dr. Sherman. That was awesome and going to be such a tough act to follow. But it looks like we're in the same area, so DC and Virginia. Like you heard, my name is Dr. Hall, and I am dually certified as a family nurse practitioner and a psychiatric nurse practitioner, currently teaching in the Psych NP program here at FNU. And yes, I completed my DNP program here as well. And like my bio says, I started off doing something totally different and ran into a nurse practitioner as a primary care provider as a young adult, and totally changed my mind and decided to go to school to become a nurse. Next slide. I spent my nursing career in labor and delivery, recovery, postpartum, nursery, you name it. I did all of the above in women's health, which kind of introduced me to a little bit of psych, right? Psych is everywhere, even though we think that we may not ever run into it. Next slide. So I graduated from FNP school in 2013, and my first job right out of FNP school was pain management. And again, pain management, chronic pain can leave people with severe anxiety and depression and sleep disorders. So you name it. There was a lot of psychiatric care that I had to help with there. And so I felt ill-equipped, so I decided to go back and ended up getting my psych nurse practitioner degree in 2018, which led to my baby. Next slide. Which is Alpha Psychiatric Services. We opened our doors in 2019, so female-owned, NP-owned, minority-owned mental health clinic, where we do medication management and therapy. When I first opened up the practice, we had an 1,100 to 1 patient to provider ratio. Now we are considered an underserved area due to the pandemic and several practices in the area closing. There are no insurances that I don't accept. I even take self-pay. I see everyone. So I think that everybody deserves care. And while a lot of practices are transitioning to the cash pay model, I am one of the ones who refuses to. So I just think that it's so important that we bridge the gap in serving the mental health community. I have 2 other nurse practitioners that work with me and 1 physician assistant. So I'm very, very proud of Alpha Psychiatric, and we're entering into year 4. Next slide. So you can imagine what it was like opening up a new practice and then coming into the DNP program and thinking to myself, well, you know, I am the practice owner. There are so many gaps that we could potentially address because we're just starting. So what do we do? So so many things to focus on. I ended up choosing tobacco cessation. A lot of patients who deal with mental illness use tobacco, smoking, whether it's vaping, as a way to cope. And so I'm sure you guys have encountered that. And so the first thing I had to do, my first tool that you see on your left-hand side was the tobacco screening form. You know, I had providers that weren't even screening for tobacco use, right? That's something that we're supposed to do all the time. I didn't even have 100% screening on that. So that was mind-blowing to me. So I had to fix that problem first. So once we got that down, we had 100% screening. Okay, great. So those who screened positive, they were on a scale from 1 to 5. only those who scored a 3 to 5, we engaged with whether or not they wanted to quit. So if they scored a 3 to 5, I would use the second tool, which was a shared decision-making tool. And I would say, okay, if you were to quit, what would you do? Would you, those are the options on the tool. Would you quit cold turkey? Would you use a medication assisted? Would you use an over the counter? And then we will kind of walk through it and kind of set a date for their quitting. And so then I followed up weekly throughout the study for patients who elected to quit. We set, who set a quit date, followed up weekly with phone calls. At the time that we started the study, we had approximately 2,000 patients within the practice. 536 patients were screened, and then 128 identified as smokers, and we were able to get 13% of those to quit. So that was pretty good. Next slide. And those are the halls. So that's my last slide. Let's see, we had Cam almost exactly a year ago, and so he will be 1 on Monday, and that's what I dressed him up for as Halloween. So there we are, a firefighter and a Dalmatian puppy for Halloween. So that is what I do with my life, as if it isn't busy enough. Thank you.
Katia, thank you so much for that. I am just in awe of the number of times that you went back and got more education and did something different and did something different and did something different. And so amazing. So I'm sure many people will want to ask you questions as well. Our next presenter is Dr. Kevin Scalf, who resides in rural southeastern Kentucky and has always had a desire to improve the health and well-being of his community. His passion for healthcare began at an early age, and he has had the privilege of being a nurse for the last 20 plus years. Working in a variety of healthcare venues, Dr. Scalf has had the opportunity to appreciate the complexity and importance of high-quality healthcare. He has worked as a psychiatric mental health nurse practitioner for the past 7 years and serves as course coordinator and regional clinical faculty at Frontier Nursing University. He truly loves being a part of helping patients and families reach a higher quality of health. And Dr. Scalf.
Thank you so much. Thanks so much for that introduction. Hi, everyone. Like Dr. Gianellis said, I'm Kevin Scalf, and I live in rural Southeast Kentucky. And I'd like to talk to you a few moments tonight about my Dnp project that I did as a student here at FNU. So the place where I implemented my project was the Psychiatric Center, or the Inpatient Psychiatric Hospital, where I currently work part-time. It's located in Hazard, Kentucky. And according to the Census Bureau, the most recent one, there are about 5,300 people who reside in the city limits of Hazard. And the median family income in Hazard is around $28,000 per year. And Hazard is located within Perry County. And recently, Perry County was recognized as being one of the top 10 counties across the nation for hospitalization rates secondary to opioid abuse. So that's kind of what led me down this path when I was thinking about quality improvement projects and opportunities that our facility could make to really improve the lives of our patients. Next slide. So the title of my project was Implementing Effective Care Using National Practice Guidelines for Acute Opioid Withdrawal in the Inpatient Setting. You can kind of see on the right-hand side a picture of a cow, and it says, have you completed your cow's assessment today? Our team decided to kind of post these little pictures across the hospital just for generalized awareness. We had them in places like the break room, certain places in the nursing station, and also the restrooms. So we tried to spread the word, keep everyone abreast of what we were doing, but we thought this was a good little place to start to maintain awareness of what we were doing. Next slide. The aim of our project was to really increase patient-centered and effective care through screening and appropriate treatment of patients with acute opioid withdrawal symptoms by 50% in 8 weeks. Next slide. So one of the first things we did was we looked at patient education. One of the things that we found was that patient education regarding the signs and symptoms of acute opioid withdrawal was really not being done on a routine basis at our facility. So our team developed a generalized handout that was given to and explained to patients who would be at risk for experiencing some of those symptoms. This really helped to involve the patient in care delivery, and I think it empowered them to better understand certain aspects of their healthcare management. Our team really tried to make this handout very simple, but yet informative so that the patients could easily understand. Next slide. The next thing that we looked at was assessment. You can kind of see here a picture of the clinical opioid withdrawal scale, or also known as the COWS, that we implemented at our facility. We realized that there had really been no standardized routine assessment tool being used by the nursing staff when they were looking for signs and symptoms of acute opioid withdrawal. We educated the nursing staff about this tool and really made this a part of the general nursing orientation as well for new hires. The nursing staff started to conduct the COWS assessment every 6 hours for patients who were identified as being at risk for experiencing acute opioid withdrawal symptoms. And by doing this, every nurse was assessing and looking at for some of the same symptoms across the hospital, no matter what unit they were on. When the nursing staff was performing a withdrawal check, they were looking at the same material. And this really helped to streamline the assessment process and deliver overall better care. Next slide. The other thing that we found during this process, we discovered that there was a lot of variability in provider orders for patients who were experiencing acute opioid withdrawal symptoms. Sometimes the orders for symptom management treatment was there, other times really not. So our team worked with all of the providers at the facility, and we designed a standardized list of commonly used medications for the symptomatic management of acute opioid withdrawal. This really helped once we implemented it. It really did help to provide consistency in care delivery, and it really just promoted better overall clinical health outcomes. Next slide. We had to work very hard with team engagement, and you can kind of see a picture here. And the picture here are some of the key stakeholders in the very early meetings as we discussed the project and what we wanted the project to look like and what we wanted it to be. These individuals served and acted as staff champions and really helped to get buy-in from their colleagues about this project. This project was implemented hospital-wide, so one person could not do this project at all. It really took a team for everyone to be on the same page and roll this out in a way that everyone felt comfortable in their role. So throughout the project, we routinely met, we reviewed the data, and collectively we decided future actions that we should take. We had little team engagement parties throughout the course of this period of time. We gave away things like cows, candy, brown cow ice creams. We tried to kind of make it fun, and we really tried to engage the staff as we worked through this. Next slide. So here is a picture toward the end of the project. We were celebrating success. So the staff members here are holding a vision board that we kept in one of our break rooms. And the vision board really helped everyone to see the changes that we were making and the progress that we were making as a result of the interventions that we implemented. Overall, at the conclusion of the project, we really looked at multiple things, and we started again with patient education, got the patient involved. We made sure that the nursing staff were comfortable in performing withdrawal checks. We made sure that the providers were looking at symptomatic management when patients did experience those symptoms. And then we also worked to try to keep the staff morale up, keep them energized, and really help to provide overall better quality of care. And that's all I have. Thank you.
Thank you, Kevin. So interesting to see how these projects and quality improvement impacts different communities. Very grateful to have you on this panel. So next up, we have Dr. Diane John. Dr. John is an associate professor at Frontier Nursing University. She earned her doctorate of philosophy in nursing from Barry University in Miami, Florida, a master's degree and a bachelor's degree from Florida Atlantic University. She has dedicated 40+ years of service to the nursing profession, which includes 20 years of her professional career in leadership and teaching in the academic setting. Her scholarly accomplishments have focused on a variety of topics, which include nursing education, technology, women's health, leadership, health policy, and primary care issues. Throughout her career, she has served on dissertation committees, organization boards, and academic committees. Her passion is working in the community, and she will share some of these projects with you today.
Thank you so much, Dr. Gianellis. And I forgot to mention in that bio that I'm also a family nurse practitioner working per diem with veterans and other settings. So thank you for having me this evening. So this particular slide is a depiction of a community model where APNs are collaborating with the community. And we do a varied types of projects where we host series of virtual talks focused on health issues and social issues. We are advocating for the communities. I serve on a social justice task force and also member on various boards at the county, city, and local level. You know, these experiences have allowed me to broaden my knowledge when it comes to budgets, right? Budgeting and funding and the various resources that we need to carry out different sorts of projects. So you can see to the right on the bottom, we have a series or a number of NPs networking with nurse educators. You'll see in the center, the APNs, advanced practice nurses, and stakeholders surrounding the community. And none of this can be done without adequate resources, IT support, physical spaces, marketing, and funding. And advanced practice nurses are involved in all types of venues that foster, gaining these resources. So, I always talk with students about, yes, clinical practice, but you also have to expand your knowledge in how to run a business, how to get funding for a project, how to get the resources that you need. So that becomes a part of your educational journey as well. You can advance the slide. So here is one community project, and you can see me there on the left, and on the right is Dr. Vicki Stone-Gale. She's the president of our South Florida Council of Advanced Practice Nurses. And I received funding for a project titled Nurse Practitioners Influencing Heart Healthy Behaviors. And again, this involved marketing, getting different resources, stakeholders, and collaboration with the community. This was an event at a local church. It's a large church in Fort Lauderdale, Florida, which is in South Florida. And they were holding a combination back to school and health event. And we were invited to participate. You can advance. Here is another photo from that same Heart Healthy project. These are all nurse practitioners, with the exception of the person on the right. She's a community health worker. So another opportunity to collaborate with the community. Our community health workers are very, very valuable in getting us access to people in the community and in gaining that trust. I've heard tonight from Dr. Sherman, how trust can really begin to build bridges and get things done, for many people in our community. And for us, our community health workers are very instrumental to that. You can advance. Another event, this one was with our vocational school here in South Florida. And with this particular event, we needed bilingual and multilingual nurse practitioners, and they answered the call. You know, through our South Florida Council for Advanced Practice Nurses, we have a diverse group of NPs, and we had NPs who spoke Spanish, Creole, and many other languages, and they were able to communicate with different populations at this school event. With this particular project, we were using motivational interviewing strategies as a way to improve heart health for individuals living in the community. And, you know, according to our Florida Department of Health, among African Americans, heart disease is at a 64.8% high, and Hispanics, 57.3% of that population suffer with heart disease. So you can see that there's a lot of work to be done in this area. You can advance. You can advance, Kristen. And this is another event. This is an outdoor event because of COVID. And you can go back, Kristen, go back one. This is an outdoor event, you know, in the midst of COVID. And again, members from the NP community collaborating with community dwellers about ways to improve health, different things that they can do. You know, strategies for eating well, exercising, you know, taking your medication, and many other things that we know really that improve the outcomes for individuals. So just another visual of the many different things that nurse practitioners do outside of the clinical arena. You can advance, Kristen. And so this particular picture is near and dear to my heart because this is one of our local YMCAs. My son, who is now 40, went to this YMCA as a kid. And this is what it looked like, or this is what it does look like. You know, they're in the process of building a new one. But as an advanced practice nurse, I was able to serve on the board, be involved in the plans to build a new YMCA, have a voice in the services offered to the community, and also have a voice concerning the budget. We're talking about millions of dollars dedicated to building a new YMCA, and they wanted to hear the voice of advanced practice nurses so that they could serve the needs of the community. You can advance, Kristen. And here I am with the CEO of the South Florida chapter. She's on the left, and one of the directors over health services, he's in the center. And so as a result of nurses and nurse practitioners being involved, they will have a primary care center at the site serving the local community. They also have different venues that will have an economic impact, having a barbershop there, venues for people to sell different goods from the community. There's a local college that will also offer training programs, an opportunity for people to get certificates, also an opportunity, additional opportunities for employment for people in the community, and many different activities for seniors, teens, and children. And I truly believe that a lot of this is because they reached out to the nursing community, and of course, we were already there to assist and support them. You can advance, Kristen. And this is a picture of the new YMCA. So we're talking about 40 years of being involved, you know, pushing. I mean, it was just, I don't have the words to describe what it took to even get someone's attention that there was a need for a new YMCA in this community. You know, where people go to live, relax, receive health care has a significant impact on their health outcomes. You know, when we talk about social determinants of health, the environments in which they interact with us have a significant impact on their health outcomes. Where they can go and exercise, and receive information in a safe environment has a significant impact on their health outcomes. I can't say it enough. You can advance, Kristen. Another event where there was a call from the community to learn more about the services that advanced practice nurses provide. We have opportunities to share that we offer mental health services. I mean, we had Katia and Kevin here talking about the mental health services that they provide. We had Rachel talking about end of life and palliative care. Our communities want to know about this. Pediatrics, dermatology, women's health, men's health, so much more. So this is an opportunity for us to really share and showcase what it is that advanced practice nurses do. You can advance, Kristen. And finally, this is a slide from one of our virtual presentations where NPs and CNMs and many other individuals at that advanced level volunteer to share their knowledge with individuals from the community. And these are virtual events. We do them quarterly. And you can see one of our colleagues from Frontier, Dr. Shaughnessy Vines. Shaughnessy did a little piece on women's health. And, you know, just an array of advanced practice nurses. Michelle Henry talked about derm, Stephanie Jackson, pediatrics, Janice Linton, palliative care, Nicole Hall, nutrition and exercise, and Marcia Derby about mindfulness and wellness. So these are the things that we do. We have really good responses from the community. So I encourage everyone, our students, our NPs to get out there and really make a difference. They're looking for us, they're waiting for us. And what I hear from people in the community is that they are in awe when they see NPs or providers who look like them. So remember that, and don't be afraid to speak up for what you really believe in, because it'll have a significant impact on the health of those that we serve. Thank you so much for having me.
What a fantastic way to finish us off tonight. I'm going to stop sharing at this point. I'd love to see what questions our audience has. Dr. John, what a tremendous breadth of experience in quality improvement and really tying it all together. So I am going to see if anyone has questions for our panelists. Now would be a great time. You can either type them in the chat, you can raise your hand. If not, I have a few, ideas of things that we might want to chat about. It looks like I'm looking through the chat and it is just awesome, amazing, wonderful. Everybody really looks like enjoyed this presentation so much. This has been so inspiring, really great and amazing work here. And I see one hand up, but I believe it was the hand when we were trying to figure out it, Dr. John's hand.
Well, I actually I have a question.
Sure.
In regard to the tools that were used to make the conversation guide checklist, it was a great idea, and it's something that I'm thinking about for my project. So just a question about if there is some evidence you can point me to for where there are templates of such a thing. It just was very intriguing. Thank you.
So Lynn, I think I see Lynn on the screen here. What I did to guide that conversation, or at least gather the questions, I went to resources like Speak Up Canada or the Conversation Project. I even looked at the 5 wishes, and I pulled questions out that I felt would really get to the heart of what was important to the patient and identify their values. So when you're looking to structure something for how you should answer or how you should ask those questions, you'll pull information from multiple resources. And those are just, some of the main ones. Like I said, the Conversation Project, 5 Wishes, the American Bar Association for Healthcare Advanced Care Planning, and Speak Up Canada.
Excellent. Thank you so much, Dr. Sherman. Yeah.
I also have a question for Dr. Sherman, if that's okay. My name is Charlotte. I am in DNP planning, and I work in inpatient palliative care. I think my challenge at this point is I feel like all of the shared decision-making tools that I'm coming across, they're kind of lengthy. So I know I'll definitely have to create my own, but I guess just thinking about being on the inpatient side, it's a little bit more challenging because, some of these questions are a little bit more scary for patients because they're actually in the midst of an acute illness, and just thinking about how much information they can take in at that time versus being able to take home, the conversation starter guide or the What Matters to Me workbook, and looking at that, over the next couple of days. Any words of advice?
So I think that you're already on the right track. In recognizing that the needs of an inpatient palliative patient are much different from the needs of an outpatient palliative patient. When you have someone who's going through an acute illness, it can be very difficult to give them a bunch of information or ask them to answer broad, oversweeping questions, because at that moment, their mind is really focused on what's happening with them. A lot of times when I'm dealing with patients on the inpatient setting, my questions will be very structured towards what's happening with them at the moment. More importantly, who's going to make that decision for you? Let me tell you where you are. What is most important to you right now? We just diagnosed you with stage 4 cancer. What are you thinking? How can I support you in that? Sometimes it may just be, let me get somebody to come and talk and spend some time with you. That's my social worker or my chaplain. So knowing the needs of your patient can really help you to structure that. Maybe your goal should just be to get them to identify the person that's going to make their decisions or make steps towards having the conversation.
That's helpful. Thank you. I do think kind of where I'm looking at is more so let's get a healthcare power of attorney, and then just making sure that we're giving care in an emergency, like code status wise. Those are kind of the 2 biggest things that we look at. So thank you for your input and your feedback.
You're welcome. Best of luck.
So I see, I'm trying to monitor the chat, the text chat as well. And I see a question here from Brooke, who says, I'm so impressed by how involved everyone is in their communities, even outside of their main practice settings. For those of us who are newer to our area, your advice to get more involved. One of our panelists, how do we get involved with our community? I personally can speak to that, although I will let someone else speak as well. But I will say that, I'm not exactly new to my community, but I have been really jumping on the vaccine clinics for COVID-19. There seems to, at first, everyone wanted to help. And then now with the boosters, people are like, well, I'm kind of busy now. And so I have been volunteering for things like that through my local FQHC, but also just getting out there and really working with the community access workers. We've gone out into parks in Providence and vaccinated homeless persons. We've gone out into, today I was at the unemployment line, pulling people out of line to vaccinate them while they were waiting. And so, really looking for who are the people who are movers and shakers in your community and latching on there. Dr. John, I think you were going to say something.
Yes, Dr. Gianellis. So, I live near a local park. So pre-COVID, every Tuesday morning, I would go at about 9 o'clock and people were out there walking, and I said, take blood pressures, and provide some education about that. I also would just do a Google search of local health events or back to school events, contact the sponsors to see if we could have a table there to provide some health information. So just something as small as that really opens the doors to bigger things. And once they see your face and they know that you are committed and you're not there just to do a project and leave, or you got a grant and so you're going to come and spend that money and then they'll never see you again. They're very, very leery of that. So I'm pretty consistent in being involved. So that would be a great way to start. Or contact your local YMCA. They're always looking for help. They're always looking for volunteers. And when you say you're a nurse, you're automatically in, so that's another great way to get started.
You can always reach out to your local leaders, legislators, councilmen. I'm not afraid to knock on anyone's door. Primaries are coming up for Maryland next year, so this is the perfect time to show up with an issue, especially when you want them to back you. When Maryland wanted backing for the workplace violence bill, particularly because nurses were experiencing more workplace violence, like we showed up and we showed out at some of these legislators' doors and was like, if you don't back us, we will not vote for you. And trust, I want you to understand that everybody has a cousin or a sister or a brother or a dad, somebody that's a nurse. So we will find a way to have our voices heard. So you can always reach out to your local policymakers and councilmen.
Excellent. And for those of you who are DNP students or just students in general and thinking, wow, I'm not sure I can go out and knock on a door of and talk about these things, those are skills that you will develop over time. And really, I am so thankful for the program here at Frontier for preparing me for that type of, to feel comfortable enough to go out and really be a voice for patients and for health change in my community. Does anyone else have any questions for our panelists?
I don't have a question, but I have a comment. This was fantastic. These 4 panelists were so inspiring, and I'm sure every one of us agree. One quick comment though to Dr. John. It sounds like we're locals. She's in South Florida. I heard her mention that several times. Are you living down in this area?
Yes, I'm in Miramar. Where are you, Darla?
I am in Fort Lauderdale, but boy, I would like to connect with you. I know we're talking about connecting to networking, but boy, you're just what you do. And every one of you, I just can admire and just feel a communication or a connection with, because in each of your studies and each of your projects, I think all of us feel, wow, that's what I could do there, or that's what's happening in my office, or just fabulous. Thank you all very, very much.
Let's connect, Darla. Send me an email.
I will.
And yeah, let's make some connections. There's a lot of work to do. We'll
Yes,
find
there
a place
is.
for you, most definitely.
I agree. Thank you.
All right. Well, to save, because we're at the time limit right now, I just want to thank our 4 panelists for sharing their stories with us. Truly inspiring, truly amazing. I know that I have enjoyed listening to your stories. And thank you to everyone who came to this event tonight. We really hope that you enjoyed this style of storytelling with pictures. We really are truly grateful to all of the nurse practitioners out there who are making a difference in their community.